Good evening. Welcome to Stay Tuned. I'm Casey Nolan. Whether you call it the Affordable Care Act or Obamacare, whether you love it, hate it, or aren't quite sure, chances are you're like a lot of people and you have a lot of questions about the new health care law. Well, tonight we are trying to explain one very specific and a lot of people say very vital aspect of the new law, the insurance marketplace. One main goal of the Affordable Care Act is to make sure that every American has health insurance. The new health care law aims to eliminate barriers like job status, income, and medical history that have often left Americans uninsured or underinsured. Under this legislation, everyone is required to be insured by 2014 or face a penalty. One way to enroll is through the insurance marketplace, also called the exchange, a place to shop and compare subsidized insurance plans. But a lot of people still have a lot of questions. Am I eligible? What if I already have coverage? Is the marketplace for me? Tonight, we hope to have some answers. So stay tuned. Well, let's start the show with a very basic understanding of exactly what we're talking about and the words we are using. Tim McBride from Washington University is back with us tonight. Thanks for being here. You've read the Affordable Care Act from cover to cover, correct?
Yes, we have. Yes, I have. Yeah.
Okay, and so in case not everyone got the memo, like me, it was exchange, if I'm not mistaken, and now these are the healthcare insurance marketplace. What are these terms? What do they mean?
Well, the insurance marketplace is essentially what it's described to be. It's a market where people can go and purchase insurance from private insurance plans.
Okay, who is there a difference, first of all, between exchange and marketplace? Do we need
No, not. It's essentially the same thing. They just changed the term because there's another term that has the same acronym.
Okay, so who is the insurance marketplace for? Who can benefit from shopping for insurance in the marketplace?
Essentially, it's people who are without insurance, the uninsured, or people who are with small employers who don't have health insurance.
If I have it already, do I need to shop there?
No, unless you can get a better deal from going to the health insurance marketplace, and it's for people who are above the poverty line, and people from 100% to 400% of the poverty line can get a subsidy from the federal government.
All of this we're going to break down more as the night goes on,
as
we go through. Okay, some more terminology here, though. We've got federally facilitated and state facilitated exchanges or marketplace. What's going on there?
You know, to most people who will be going to the exchanges to the marketplace, it won't really matter. The Missouri exchange is federally facilitated. The Illinois one is a state exchange, and that's not going to be that apparent to most people, but it just means the federal government is essentially running the one in Missouri, and the state government is running the one in Illinois.
This is something in Missouri we opted not to do.
That's right, exactly.
Okay, does the marketplace, what does it mean for those who won't be using the marketplace? Is this something that everyone should be concerned about and be knowledgeable about?
You know, I think it's good to be knowledgeable about it, but if you have insurance through your employer and you can keep it, you don't really need to know about it. So,
what about the role? I said vital, some say, and the little open there. What role does this marketplace play overall in the Affordable Care Act?
I think it's one of the most crucial pieces of the act because it's where essentially about 15 million people are probably eventually going to get health insurance coverage, maybe upwards to about 20 in the long run. And it's the place where a lot of the insurance reforms are going to be enacted in the long run. And but that'll probably take a few years for that to all transform. And it's going to roll out in many of the states at different levels as we go through. In Missouri, there's 10 rating areas, so in different parts of the state, it's going to play out in different ways. There are about 2 different insurance companies offering plans in different parts of the state, but there's different levels of plans that people can buy at different premiums.
Within the
So-
marketplace, we're going to talk more about that later. But there are different tiers. You can
Right.
pay more, you can
Right.
pay less. You can get more, you can get less. So
That's
to
right,
speak.
exactly.
You said 15 million more likely will be in the system, if you will, through the marketplace.
That's some of the projections nationwide, yeah.
What does that mean for our healthcare system? What will that do to our healthcare system?
Well, we're going to have to see. I mean, I think it's a good thing overall because we're going to eventually ratchet down the uninsured, which nationwide is about 50 million. And we hope that in the long run, maybe 30 million or so will be getting insurance by, 2020 or so. And we'll still have some uninsured because there's some people that are not eligible for the exchanges and some people that won't pick up coverage.
But you said
So-
you said one of the most important parts. I want to have you elaborate on that. Why the most important part of the healthcare?
Well,
law?
our system of health insurance has been built for a long time on a system of private insurance. And this builds on that system of private insurance and layers on it a way for people to continue to buy private insurance, but it allows people to go in and purchase insurance in ways that they'd not been able to before because it's not been affordable. And it's not been affordable in two ways. One, if you've had pre-existing conditions, you now will be able to afford it because of some of the reforms of the Affordable Care Act. And also it's going to be affordable because of the subsidies that will be available in the Affordable Care Act for those between 100 and 400% of the poverty line. It's going to be quite cheap for some people, just about 2% of their income, up to about 10% of their income. So in those two ways, it's going to be very affordable to people, we believe. And it's also going to be creating an essential benefit package that's going to have benefits that might not have been available to people up until now. And then we're going to talk later about the Medicaid expansion, but that's not really a topic for tonight. And obviously in Missouri, we didn't do that. But
It plays
that's
a
going to be
role.
a topic for later.
Yeah, no, for sure. There are a lot of things that you have done a great job of setting the
Yes,
table for
that's
here.
setting the table for tonight's
So thank you.
conversation.
Remember, salad forks on the outside,
That's-
having set the table.
Right.
All right, and social media is a key ingredient to this table that we have set, and Ed Reggie is going to tell us more about that. Ed?
Thanks, Casey. Well, we've been hearing a lot about the Affordable Care Act on the news and across social media, and we'd like to understand what you need to know. We'll be monitoring the Facebook and Twitter tonight, and we want you to ask questions or tell us your insights or tell us what we're missing. Now, there are several ways you could do this. You could go to our Facebook page, the 9 Network. Earlier today, we posted there a question. We asked you if you could share what you want to know about the healthcare exchanges, and we will be answering those questions throughout the show. We can also tweet us using the hashtag StayTunedSTL, and we'll be bringing those tweets to you throughout the evening. It's a robust conversation already. Here's what you're already saying.
I think something we want to talk about before we get into the very kind of nitty-gritty, which we will do later, of these marketplaces, because we want to walk away from here tonight with an understanding of what these marketplaces are all about. I want to talk more about something we just touched on there with Tim, that is the role of the marketplace in the Affordable Care Act. And we have some great guests here to help us do that. I'll do some introductions first, starting with Kevin Regent over at the Regent Law Firm. How great that you grew up and were able to work at a place that has the same name as you.
Amazing coincidence.
That's a fascinating coincidence. Sydney Watson, that's my last joke for the night, just so we're clear. Sydney Watson from St. Louis University Law School, and Mark Smith, St. Louis Area Agency on Aging. You are also you're one of the qualified navigators that we will be hearing about more tonight. So I'll ask you just that. Does this marketplace that we're talking about, does that have to work for the overall Affordable Health Care Act to work?
Yes. The Affordable Care Act is about reforming and changing how we purchase insurance and how insurance is sold in this country. And the marketplace is central to that, to create a better functioning marketplace.
And I think it's important to add the marketplace needs to attract healthy clientele. I mean, if you have adverse selection of only those with conditions who couldn't be insured getting in, it'll be difficult for the marketplace to succeed. But if you can attract those younger, healthier participants, new participants, I think that will bode well for the law's future.
Yeah. There are also new market rules that make it easier to shop and more attractive to shop for individual insurance in the marketplace.
What do you mean, new market rules? I mean, what does that mean?
No pre-existing condition exclusions. You can't be turned away because you're sick. You can't be charged more because you have a health condition. New rules about what health insurance have to cover, 10 essential health benefits, new limits on out-of-pocket expenses. It makes insurance better and a better value for your dollar, and we hope that's going to bring in young, healthy people as well as older, sicker people.
Go ahead.
I was going to say, and because of those, those new rules, it's even more essential to bring in the young people because, those new costs of pre-existing condition patients. It's great that they can get coverage, but those costs need to be covered. They need to be basically socialized. It's all insurance is socialization of costs. And now that the spread of what you can charge the healthiest to the not healthiest, in Missouri it used to be about 9 to 1, 9.5 to 1, is now 3 to 1. So you need a lot of people at the healthy range to cover those newly insured people to make the system really succeed and keep the insurers involved. Because remember, it's built on the private system. Built in the private insurance system, a profit-driven system. So you need to make sure that those insurance companies can still make profits to stay in, to keep offering the programs through the exchange.
Although one of the things that happens with the Affordable Care Act is we've limited the amount of profits that insurance companies can make. So there are now new rules about how much of our premium dollars has to be returned to us in health care. And those limits are going to apply to both products sold in the exchange and health insurance sold out of the exchange. And that's important for all of us.
Okay, so something else we touched on with Tim. What does more people in the system mean to our healthcare system? Is that going to have an impact?
It means we'll be giving people preventive care and wellness care, helping them learn how to take care of their diabetes, how to control their high blood pressure, and hopefully over the long run we'll be a healthier population, a more productive workforce. Remember, part of what we've already instituted with the Affordable Care Act is a requirement that health insurers cover an annual preventive care checkup at no cost. So it's an important way we're changing the focus of medical care.
Mark, is this information getting out to the people you work with when it comes to the marketplace?
Well, we're working really hard at getting that information out to people and making sure people have the facts in front of them to make wise and informed decisions. We're finding that a lot of people are very confused. There's just a lot of misinformation out there, and we want to do the best we can to get that information in front of folks to make those important decisions for themselves. I mean, health insurance is such an important piece of a person's health in their life, and we want them to have the facts in front of themselves.
What's the number one reason? Why are they? I don't want to ask you what they're confused about because I don't want to put out bad information. But why? I guess I'll start with why, and then maybe we can figure out how to prevent that.
Why are people confused?
Yeah. What's the problem?
Well, I mean, that's a good question. I mean, it's health insurance. Health insurance in and of itself can be kind of a confusing thing to understand, and people are kind of stuck in wanting to know what those facts are, but there's not a lot of ways out there for people to know what they are. I mean, we're starting to get the word out, starting to come out, but this has been a long process. The Affordable Care Act has been around for a couple of years, and there's different pieces that have been coming into effect. And so there's just a lot for people to learn.
It seemed like October 2013 would never get here, and here we are, and they've opened up this month, these marketplaces. So again, without trying to bring out the bad information, what is the good information that you wish people knew that sometimes you hear questions about? What would be that piece of information?
Well, the first thing I would say is that people really should go ahead and talk to somebody, a navigator, call the 1-800 number, go to healthcare.gov, and put in their information and see if they might be eligible for some subsidies. Health insurance is a monthly cost that people need to budget for, and if they might be eligible for a subsidy, well, that could really help them. And they may be able to afford insurance now, or may be able to get something cheaper than what they have or something of higher quality.
continuing to crawl before we walk. That's the third time I think we've mentioned navigator. I'll leave the floor to you for a second, since you are part of the navigation.
Right.
What is it? What is a navigator?
Okay. Well,
Are you voice activated?
yeah. We're doing three different things, three main things. We're out doing presentations, just educating the public in group settings. And we're also doing that on a one-on-one basis, answering people's questions. They can call in to us. They can have a one-on-one appointment in person. And then we're actually going to walk people through the application and help them navigate the website or the 1-800 number, whatever that may be for them.
Right.
And help them get all the right information into the system, get the response from the marketplace to what their options are.
Tim mentioned the effects of Medicaid expansion or the lack thereof in Missouri. How does that play a role into this conversation we're having here?
Well, it's a critical role. We have about 500,000 Missourians who are going to be eligible for new coverage, and most of those people, about 80%, eligible for subsidized coverage through the marketplace. We have another 300,000 Missourians who earn under the poverty level, for whom there are no premium tax credits. The way the law was designed, there was supposed to be a Medicaid expansion for the poorest Americans, and then new premium tax credits for those earning a little bit more than that. The Supreme Court decided that that would be the state's decision whether to expand Medicaid, and the Missouri General Assembly has not yet decided to do that. So we have 300,000 Missourians left out. They can shop in the marketplace. The trouble is they have to pay the full cost of health insurance, which when you're making minimum wage can be just too much.
We're about 15 seconds in this segment. Did I cut you off on that same question there, with the Medicaid aspect of this conversation?
No, I would say I would build on what Professor Watson said and say that I know there are efforts in the Missouri General Assembly. I know she's aware of them, to see if there can be some solution to the issue of people ineligible for coverage and ineligible for to enter the marketplace. And we will see in the next General Assembly session if any fruit can be born from that.
Very good. Thank you all for your time. We have to leave it there at this point in the conversation. And in our, we were very intentional tonight about getting the information out there. So we have some resources for you. And to direct you to those resources, I can tell you that if you can just go to 9net.org/health, you will find more there. And we would like to find more from you right now back on social media. So this isn't a conversation just to be had with those in the healthcare profession. The community organizations are getting involved in the marketplace and the information about the marketplaces as well. Let's go via the magic of Google Hangout to the far southwest corner of the state, to Greene County, with Corey Mahalik, a health librarian with the Springfield Greene County Library System. I guess, Corey, real quickly, a health librarian is what? Help us know what you do.
I'm kind of a subject specialist within the library to handle special research questions and things like that. But other than that, I also work with community members that are focused on health-specific topics, and I'm responsible for training library staff in health-related issues and things like that, especially things like the Affordable Care Act.
So how did you find yourself in this conversation there in Greene County? Tell me what the library's role is in the marketplace.
Well, we are the information source for the community. A lot of people use us or come in to ask questions that they may have on any issue. And this is a huge thing that people are going to ask questions about, so we decided we need to be prepared. So we had materials, staff training, but we're also providing a navigator on site through Primaris, who's one of the other statewide navigators, to help people actually come in and maybe get assistance in actually going through the sign-up process and all of that.
So that's the, you're not taking on the role of trying to explain it for them. You are the place where they can come for information, and you actually have that navigator on site.
Yes, and also this is an internet system where they have to go online and sign up if they're not doing the phone sign up or things like that. So we're also where a lot of people go for technology resources, that they can use the internet to go on the exchanges and do the signups, and we're there to assist them with technological issues or things like that.
Yeah, I know. When you go onto healthcare.gov and it says if you don't have an email address, here's how to get one. You do.
Right.
It is part of our reality now. So what has the response been? What are you hearing? What are you seeing?
We've had a lot of response. There have been a lot of people. Our navigator has been absolutely crazy busy. A lot of people are coming in to talk. A lot of our front desk staff have gotten a lot of questions about this. I mean, people just want some sort of information. And there's not a lot of information out there, and we're happy to give them everything we can get and hopefully help them.
So, if we are now in a time when our library front desk staff, as you just said, are now trained to handle healthcare questions, tell me why this is such a need in your community. What role is your library playing that this is needed where you are in Greene County?
Well, I mean, in Greene County, and especially the Southwest Missouri region, there's a lot of rural areas. There's a lot of places that haven't gotten a lot of attention from a lot of these agencies who are trying to educate the public and all of this, and there's just not a lot of information out there for anybody, especially in our region. And we are the information source for the community for neutral, good information. So we're just trying to get out as much of that as we can, because we know people are going to be having these questions.
Where did you get your information? I mean, did you pattern yourself after another library somewhere else?
Not necessarily. I mean, like I said, we do have the navigator on site who is the person that will be handling the majority of the questions. We also got a lot of materials from the Cover Missouri Coalition, who's doing a lot around the state. A lot of our materials on frequently asked questions and things like that are pre-made that we can hand out to people. And just studying the law and, like I said, doing staff training, and as much as we can help people figure out what to do, the better.
So what are they saying when they come in? What are those frequently asked questions? Are they coming in to use the internet and sign up, or are they coming in for information and understanding?
Both. And we are getting a lot of questions, but I mean, without there being much information out there, a lot of it is just tell me what this is. What is this Obamacare I keep hearing about? Or what is this Affordable Care Act I keep hearing about? And a lot of the major questions have to do with how much is this going to cost me? Can I get insurance? Can I afford it? What subsidies might I be eligible for? And what's my out-of-pocket cost going to be? And I think that's a huge part for these uninsured people that they want to know.
So how would you characterize the program you've started here? Would you recommend this to other communities? Does this seem to be working for the people where you live?
Most definitely. I mean, if you have a navigator to partner with, a lot of them had pre-existing locations in their area, and we do have an Office on Aging here that has navigators on site, and other places with certified application counselors. But yes, more is always better, and this is a place people are going to ask questions. If you can have people there to help answer them, the better.
And it's such a politically charged issue. You mentioned the word neutral, a kind of a neutral space where they can go and trust the information they're getting.
Most definitely. We have no skin in this game, and that's extremely important. We're not a hospital. We're not an insurance provider. It doesn't matter to us who your insurance is or any of that. And partnering with the navigators, who are also neutral parties in this, seemed like a good fit.
Last question, how long are you going to do this?
All the way until March 31st. I mean, until the exchanges are closed, we're going to be providing assistance, and we're going to still be answering questions whenever it's not open. I mean, the rest of the year. And as long as this is a law, we're probably going to be taking questions on it.
Corey Mahalik, thank you for your time. Health librarian with Springfield and Greene County Library System. Thanks for your time. We appreciate you being on the show. Let's stick with the magic of the internet and go back to social media. We want to hear what you're saying. Okay, this is the part where the heavy lifting comes in, but the guests we have are going to make it exciting and engaging. I'm taking myself out of that equation. I'm depending on you to make this fun. But we have some really vital information we want to get out of you. Let me do some introductions first. Tim McBride, you just met him from Washington University. The guest's so nice, we had him twice. Yvonne Buehlinger with Grace Hill, thank you for being here. And also Bill Hill, insurance broker with Visor Benefits.
Correct.
So before we start our conversation, just about a month ago, as part of our ongoing coverage of health here, Anne-Marie Berger from the 9 Network went out. She caught up with a young woman who is dealing with these very issues that we are trying to explain here tonight.
My name is Marie Enger. I'm 23, and right now my primary source of income comes from cartooning.
Enger is doing what she went to college to do. She illustrates and often writes her own graphic novels. She's a freelancer, and for her, working full-time means working all the time.
Yeah, I work about 90 hours a week. If I'm not sleeping or at someone else's house, I'm drawing. There's no downtime.
And she's not complaining. Cartooning is what she loves to do. This is what she's great at. But for someone who is just starting out and working for herself, affording health care is always a concern.
Oh my gosh, yes. I have a pre-existing condition, so without health care, I can't function. I need my medication. I need to go see doctors.
Marie is affected by mental health issues, and without insurance, her prescriptions would cost about $1,500 a month. Fortunately for her, under the Affordable Care Act, Marie is covered under her parents' insurance until her 26th birthday, bringing the cost of her prescriptions down to a mere $300. Are you aware of options that you have?
I've seen some things on internet sources about it, but nothing super definite.
While she is covered now, she is very concerned about what will happen when she turns 26. Does having a pre-existing condition concern you that you'll get turned down for health insurance?
All the time, yeah. I've got a big one too, so it's kind of a really scary, ugly word that while in reality, my life is great. I'm really happy. On health insurance, they're gonna see this as a really big risk for them. And they're not gonna wanna give me a good rate or insurance at all.
Anyone between about like $15,000 a year and $46,000 a year in annual income will qualify for some sort of tax credit on the marketplace. So that really helps young adults, especially those with lower incomes or entry-level jobs, things like that, will probably be able to get affordable health care coverage on the marketplace. There are a few things that it does require.
So the young invincibles have their work cut out for them, not just in explaining the benefits of the marketplace, but spreading the word that it even exists.
Preventive services.
Take Marie, for example. Remember, she's a college graduate who's concerned about the cost of health care. Have you heard of the marketplace? Health insurance marketplace?
No.
You'll be happy to know then with the ACA that pre-existing conditions don't matter.
Yes. Very good. Good to me. Good for a lot of people.
So we were able to catch up with Marie before tonight's show. She tells us she has not shopped on the marketplace yet, but the moment she turns 26, no longer on her parents' insurance, she will. Okay, back to the table to really break down what this marketplace is, as we established, also known as the exchange. If you already have insurance, how does it impact you? Because I feel like a lot of people who are interested and have questions about this have insurance themselves. What does the marketplace mean to that person?
Well, it could impact anyone who's currently on a state guarantee pool. They're going to have the option to go directly to the carriers or to the exchange and get coverage the same as everyone else. So they would not be limited to those high ratings and also to the limited benefits that are offered through the guarantee issue pool.
If I have my insurance through my employer, does Marketplace, can I just put that aside and never think about it again, or does this apply to me too?
Generally, that's the case. I mean, I think for most employer plans, especially if you're in a large employer plan, it's probably not going to be affected other than the usual sort of increases that happen to employer plans. So, but if you're a small employer plan, you know, this might offer up some new options for people. And you know, the Affordable Care Act is going to offer some changes to, you know, for people with pre-existing conditions, as we've already discussed.
do I have to? Okay, I don't have insurance now.
Right.
I was just fired. I don't know if anyone told you, but I'm sad. But I now don't have insurance. Do I have to use the marketplace? Is that where I have to go?
No, it's not. You can go outside the exchange and get coverage from any carrier. In fact, you would probably have more options available to you outside the exchange than inside the exchange. In the state of Missouri, we actually...
Wait, say that last part again.
Okay, you'll probably have more options available to you outside the exchange as opposed to inside the exchange. Inside the exchange in the state of Missouri, we have 2 carriers, 20 plans. So your choices are going to be limited to those 20, either 10 with Anthem or 10 with Coventry. There are a whole host of carriers, United Healthcare probably being the largest, who are outside the exchange and have those same level plans available to everyone.
To meet those qualifications.
However, the advantage of going in the health insurance marketplace is that if you are under 400% of poverty, somewhere between 100 and 400%, you would potentially qualify for the tax credits. And if you are up to 250% of poverty, you also may qualify for the subsidies. That would help you in the event that you have, a large medical expense.
Which I believe those numbers roughly break down to, help me out here. If you're single, what, $45,000, and you might be looking at those subsidies.
Right. If you're under 100% of poverty, if you're a single person, is somewhere between $11,500, something like that, all the way up to $45,000 is the 400% of poverty level. So then you would qualify for a tax credit for your premiums.
Yeah, and for a family of 3, it's about $23,000 up to about $60,000 or so.
These are the tax breaks, if you will, that to help you pay your premiums.
Right.
The monthly premiums, right.
Is there someone who can't use the marketplace? Is there anyone who cannot use the marketplace?
Well, if you have Medicare, you, for example, don't have to go onto the marketplace.
I mean, and if you're on a qualifying group plan, then you are not eligible for coverage in the exchange.
You started to say?
I mean, those are the groups that are. I mean, if you already have coverage, that's then you don't need to go to the exchange. So.
Okay, so you mentioned we were just talking about premiums. There are different levels inside the marketplace. What is that about? They even have nice gold and platinum, and what does that mean? Is this am I getting different coverage depending on what I can pay for?
There's essentially, we call them the metal plans. They're the gold, silver, bronze, and then there's for the young people, there's catastrophic plans. In Missouri,
don't forget the platinum.
Well, but in Missouri, there's not going to be very many platinum plans. Outside of Missouri, there's going to be platinum plans. So and they have different levels of premiums. And if you get into the marketplace, you'll see different. I think it's very important to use the navigators and go to the website and look at what the co-payments and deductibles and other options are that people can look at, because the premiums is not the only thing that people should be looking at.
Casey, one thing to keep in mind about the metal levels, they're more a measure of an individual's out-of-pocket expense than anything else. So there are different plan designs within each one of those metallic levels.
Meaning the coverage, it may cover the same thing, it just may cost me more out of pocket, either up front or when I get the procedure.
Correct.
I think I've been pleasantly surprised at how cheap the plans came out to be in Missouri. They've ranged for a 27-year-old from about $150 to $600 or so. That seemed relative for a month. That seemed relatively low to me. I haven't been able to look at maybe you have.
Well, Tim,
the co-payments.
if we can
disagree a bit.
If I may interject here, I can help someone purchase a plan with Anthem or Coventry right now. That same 27-year-old will cost $50. So when you're moving to a
healthy
plan,
person right now, probably.
That's correct. But if you're moving to the exchange plan and you are 27 years old, you are going to see a 150% increase.
But that's a person that's totally healthy right now. This has been the problem with the insurance marketplace, and so
totally healthy is a measure. There are people who are accepted who have conditions every day.
I insured my niece. And I got a very cheap plan for under $100, but it didn't cover pregnancy and it didn't cover her gallbladder because she had previous gall surgery. So this has been the problem.
You're talking about inside or outside the marketplace on that?
This was a few years ago.
Yeah.
This has been the problem of pre-existing conditions for years. And so now we're having a level playing field, so that's totally not going to happen. Now that was the problem with that was covered by the previous film. So yes, the premiums are going to be maybe a bit higher, but everybody's going to be on the same level. And also young people, maybe the premiums are going to be a little higher, but So I think we need to look at this a little more carefully.
But the only reason your niece had a pre-existing condition is because she did not have coverage prior to.
No, it was because she had gallbladder surgery when she was 15 years old. So she had her gallbladder taken out.
Right.
And she was of a childbearing age. She was 22 years old.
And you were told about those. You were told about those when you purchased the policy,
yeah,
right?
and she had a deductible that was $4,000.
So the thing I would recommend, Casey, that I think is most important, even for people who are going into the exchange, they need to speak to a qualified agent, somebody who knows not only what the plans are in the exchange, but also what coverages are available to them from other sources.
Including the navigators we're talking about. Does that help too?
The navigators cannot discuss, or at least they're not supposed to be able to discuss other aspects of insurance. They're supposed to inform, tell people about the plans that are available, tell them what kind of subsidies are available, but they're not supposed to get into the intricate nature of the insurance itself.
I want to bring up something, gateway to better health,
Sure.
because that's something that we want to bring up in this table that we haven't touched on yet. So what can you tell me about that? What is that?
Well, Gateway to Better Health is a special program that is only available in St. Louis. Is for people who are under 100% of poverty, and it's coverage plan only available in certain federally qualified health centers as well as the county health department. So when people apply for the Gateway to Better Health program, if they're adults again, then they can receive care. They don't have a premium, and their copays are between 50 cents and $3, depending on what it is.
And has this been extended?
It was extended until the end of next year, so another year and a few months.
Okay, well, we just scratched the surface there, as we have on a few things, but I want to remind people we have more information on the site, 9net.org/health. And then from there, we have to leave it here, get some more interaction from social media right now. Thank you guys very much.
Thank you.
Let's get back out on Google Hangout. Let's go back to our old friend, Lisa Zamosky. She is a health journalist. She works for WebMD, the LA Times. Thanks for being back. And we always appreciate that national perspective you give us. So I just want to ask you right out of the gate here, does it matter, is where you live, does where you live play a role in this marketplace and how it will work for you?
Yeah, so as I think some of your guests are talking about earlier in the show, it does matter in the sense that if you live in a state not running its own marketplace, as you do in Missouri,
right.
It will be run by the federal government. And there are other states that have chosen to run their own marketplace. And as I'm sure many people are aware, there's been a lot in the news lately about the fact that the federal marketplace, in particular through healthcare.gov, has had a significant amount of problems in terms of allowing people to sign up for coverage.
Different results at the state level?
Different results at the state level. There certainly have been some glitches around the country as well, but generally speaking, we are starting to see some much higher numbers, smoother operations in terms of people being able to sign up. Just here in my home state of California, for example, there was a report out by Covered California yesterday, which is our state's marketplace, indicating that just about 95,000 people have been able to start filling out applications. So that's significantly higher than what we're seeing on the federal level just here alone.
in your reporting, are you seeing things like we just heard earlier in the show from Greene County, Missouri, our southwest corner of Missouri, where are some communities doing more than others and getting involved like that? Are you seeing examples like that?
In terms of educating the population?
Absolutely, yeah.
Yeah, I think that, around the country, we certainly see that there are generally states that have embraced health reform, have decided to expand Medicaid, have decided to run their own state marketplace. In many cases are also making a fairly significant effort to ensure that their population is educated, that they know how to sign up, where to sign up, and the new benefits available to them. There are other states that have been vehemently opposed on the opposite end of the spectrum to the law, that in some cases have actually taken active steps to thwart efforts to educate the public, and then anything in between. So it really, where you live really does seem to matter in many respects. Yeah.
What are you seeing in terms of that education level? Making the rounds on the Facebook and the YouTube was our friend Jimmy Kimmel, the late night comedian, at the expense of unsuspecting folks on the street. He was asking them, do you prefer Obamacare or the Affordable Care Act? And they thought they were two different things. And that's, that's easy to laugh at from the comfort of your couch. But what's the education level that you see in terms of around the country?
Unfortunately, I would say that while I, like everybody else, did chuckle at that, I was not wildly surprised. The education level, the understanding of the law is not great. Having said that, I answer questions through online live events and every day for WebMD, for example. People can log on and ask me questions about health reform, and I am starting to see people ask more informed questions, starting to understand a little bit, particularly getting a little bit more in the weeds as the marketplaces have opened in terms of how they go about doing this. But generally speaking, and I think also because the law has been so politicized, there's been so many different messages and misinformation, people are really confused.
So what are the questions you're getting? What are some of the most frequent questions you see, and what would you like people to know? What's your takeaway here tonight?
I think some of your guests have touched on this earlier. Undoubtedly, one of the most common questions I get is, if I have Medicare, if I have, work-based coverage, do I have to do something? Do I have to give up my insurance, or should I be shopping on the exchange? And the answer to that is absolutely not. Medicare recipients not only do not need to go on, they are not allowed to be sold a new plan on the marketplace. It's something that Centers for Medicaid and Medicare have said they do not. It is illegal for insurers to do. If you have coverage now through Medicaid, Medicare, TRICARE, work, generally speaking, this is not for you. And people are also concerned about costs. What if I don't make any money? I don't have any income. Am I going to be penalized? And the answer there again is no. First of all, there are a lot of subsidies available to help people afford coverage. And if you truly cannot afford it, for example, if the lowest cost plan is more than 8% of your income and you live in a state like Missouri not expanding Medicaid, you will not be held accountable for having coverage or for paying a penalty. So there are exceptions, and people are concerned about those.
Yeah. Lisa, thanks for your help and your information. We appreciate you being back on the show. Lisa Zamoski, healthcare journalist with WebMD, as you mentioned, also the LA Times, and an author as well. Thanks for coming back on the show.
Nice to be here. Thank you.
Thank you very much. Let's go back to social media. Okay, we've covered a lot of ground, and we may have made some mistakes, or we may have left a few things out. This is Tara Kulash with the St. Louis Post-Dispatch. Your beat is what we're talking about tonight. You're on the Affordable Care Act beat.
Yes.
So that means there is a lot of information to be covered if you have a beat dedicated to a law. Mm-hmm. So how are we doing tonight? I see you have, this is how we know you're a reporter. You have the reporter notepad. This is good. And I can't help but notice, but it's full.
It is. I was taking a lot of notes. Actually, I think that the group did a really good job tonight of kind of outlining the Affordable Care Act, saying the main points. I do think there's a few things that I should bring up, though.
Yes.
So yeah, they were talking about how the young invincibles, that we need more people signing up to keep our rates lower.
Yeah.
Okay. That is important. First of all, we're noticing at least in the first year of the the marketplace being open, people having coverage, deductibles are going to be high because they're not expecting a lot of people yet, or they're not sure how many people will sign up for this, and they don't have a whole lot of insurance carriers who have bought into it yet. So they need more people signed into it.
This is the critical mass has not been reached to be humming along at its optimal level.
I guess you could say they don't really. I mean, it's nothing. It's a gamble. It's a gamble, is what it is. That's the best way to put it. But something that's really important is how the middle class is going to be affected. So you've got these subsidies that are really going to help people with their premiums, and that's great. But a lot of people in the middle class won't be receiving subsidies, and a lot of it is because of their employer coverage. Now, if you go into the Kaiser Family Foundation, they have a subsidy calculator online. That's a really important tool to use. So if you look on that, it asks you if you have affordable coverage through your employer. And if you have affordable coverage, you are not eligible for subsidies. Now, what deems you eligible for subsidies is, I guess, your work coverage. It has to be, let's talk about you,
okay,
for example, okay?
I love to do that. It's my favorite topic.
Let's say you have 2 kids and a wife.
Okay.
On your coverage, by yourself, it's about $50 a month on your premium. That for you is affordable. The definition of affordable for you is it has to be less than 9.5% of your yearly income.
Okay.
Now, with your family added onto it, a lot of times it's a lot more expensive. It could be $500 to add more people onto this, okay? Right. The way that the Affordable Care Act works, though, is it only defines whether it's affordable based solely on you. So it would look at what the coverage is for you, how much it costs for you, and if it's affordable, then it considers your whole family gets affordable coverage through your employer, and therefore your family is not eligible for subsidies.
Are people considering that a flaw here in the law that they want to address, or is there?
I've talked to brokers who say so. Yeah, they say that that's a lot of middle-income families are going to see really high rates, and it's really going to hurt their budgets. Definitely.
You have more things on the list?
I do have more things on the list. Another issue right now, I know that navigators are really trying to reach out and help people, and that's very important, but I mean, the problem in Missouri is that they have a very low advertising budget. So word is really not getting out to people who are trying to find out information about the Affordable Care Act. I think a lot of people don't even know where the navigator locations are well enough. So I hate to shamelessly plug myself here, but the news is the place to turn here. We are the people that are studying this every day and trying to help people. And anytime someone calls us with a question, if we don't know the answer, we study it and we answer it for them. I do know that the St. Louis Health Department is having 2 days a week through mid-December. They're holding informational and enrollment sessions. And I've posted the whole schedule to that to mohealthreport.com. And you've got the People's Health Centers. They're on Delmar, and they have 2 other locations. And they're having certified application counselors with a table in their lobby and signing people up. So there's all these locations that people can go to that I don't think that many know about. There's also navigator locations that it wouldn't be a place that you would exactly guess. There's one place that's called Certified Processing Corporation, and they do marketing for agents, for brokers.
Okay.
So a consumer wouldn't necessarily think, I think I'm going to go look at Certified Processing Corporation. I bet they have navigators. So the problem is that people aren't really realizing where to find these navigators. And in Illinois, they've got $115 million advertising budget. Missouri has $4.74 million budget for advertising. So there's not as much outreach going on out there, especially it's mostly the small clinics and the federally qualified health centers that are doing the outreach, but they're getting a lot of their stuff from Missouri Foundation for Health. They're just getting some free brochures. Most of the Missouri budget was spent on hiring and training navigators.
And we're all about shameless plugs. In fact, the good folks, you only have to remember one thing: 9net.org/health.
Yes.
And
Mo Health Report.
And what I was just going to say, we'll get it all in one place there and make sure that people can find it. I'll ask you kind of what I asked Lisa when her reporting and your reporting: frequently asked questions, frequently confused issues. What are you seeing when you talk to people?
Yeah, a lot of people confused. I mean, just look at the statistics of how many people don't know about the marketplace, don't know, they're confusing the Affordable Care Act for Obamacare. Just the other day, I was reading some comments online on one of my stories. There was a bunch of people commenting, getting into arguments. And one guy started calling it HoCare. And I thought, what is this? And I started trying to Google it. I couldn't find anything on it. And another person commented and said, what does this mean? You're just trying to confuse people more. And he said that he's calling it Hussein Obama Care. And it's just, so people are really throwing out all this slang and different terms for it, and it's getting people confused. And then when you've got the lack of advertisements or, more outreach, we just need a lot more outreach.
The way we get information is
yes.
Scattered.
Yes, very.
Okay, and this is exactly the issue here too. Okay, all right. Well, Tara, thank you. We appreciate you being here and being our fact checker here tonight.
Thanks for having me.
All right, we're going to need to call on you again because I think we'll tackle this issue again. So I hope you'll come back. Okay, so when we're counting on you as well. So let's go back and see what you're saying about this. Dr. Kimmy is back with us here from St. Louis University. Thanks for coming back to the show.
My pleasure.
As a point of transparency, you were also formerly with the Missouri Health Foundation.
Correct.
You're not, and they fund a lot of the Missouri Foundation for Health. They fund some ongoing coverage of health issues here at the 9 Network, but that's not who you're speaking for tonight.
No, not at all.
So we can only blame you for the things that come out of your mouth. Can you help us out? We normally would have a doctor in the house for a show like this, and we lost our doctor to scheduling just at the last minute. So I'm curious if you, as a doctor, can tell me what are some concerns? What would a doctor say? I'm going to ask you to play a doctor on TV. What would doctors be saying in this conversation? What are you hearing from them?
Well, I think as far as the exchange is concerned, they see it as the opportunity for people who are not getting insurance and probably aren't getting medical care, getting the care they need. So I think this part of the Affordable Care Act is probably not terribly controversial with doctors.
Okay, so what is the biggest misconception about the marketplace?
I think that, I want to start with one of your tweets because it was really good. The fellow came on and he said, I went on the website and I looked at the prices and they were so high and I'm low income. Don't look at the sticker price. You've got to see what the subsidy would be. As I think Tim said early on, you have a subsidy if your income's between 100 and 400% of poverty in Missouri. So looking at the price that's up front doesn't really mean anything to you until you know what your subsidy is, because your subsidy can take care of almost all of that cost. So I think that guy had a really good point, and I think people are making a mistake in going to the website and looking at the spread of available plans and saying, my God, those are expensive. Well, they are expensive, but that's not the price. That's the sticker price.
So there's some work people have to do here.
There's work people have to do. There's some things they need to understand, and that's why we have the navigators, and that's why brokers can be of assistance to people. I think, there's a great deal of misunderstanding about this legislation, about this law. Kaiser Foundation did a survey last month. 65% of people have not even tried to get information about the Affordable Care Act. Now, it may be all the furor in Washington the last few days will get more people interested. What is this thing? I hope it does, because they need to start asking questions. They need to go to their website. They need to take advantage of the information that's out there, because there's something in this for an awful lot of people. There are 800,000 uninsured in Missouri. 93% probably would get subsidies if they went through the exchange.
You touched on it, but help us help people do this work. I mean, Apple and Google and everyone, they know we don't do work anymore, that we want things to be easy and push a button. So help people. How would you help people do that work that they're talking about? What would you suggest?
Well, I think that we've created the navigators, or the Act created the navigators and other kinds of assistance that will work with people to work through that website, which is fairly complex, okay? And I think that we've had the experience with Medicare. No one raised questions about this with Medicare. We've been doing navigating for Medicare patients for years in this state and other states. Somehow, because it's the Affordable Care Act, it became very controversial. And so Missouri has had difficulties getting up and running with their navigators, but they're there. And Missouri Foundation for Health is funding a lot of activity in terms of public information. The public has an opportunity here, and shame on them if they don't take advantage of it.
So are we behind in this state?
Oh, yeah. Missouri's far behind because the legislature made it impossible to create our own exchange. So we have a federal exchange coming into the state. A legislature that doesn't like federal government, big government, made it possible for the federal government, in fact, made it mandatory for the federal government to be the exchange for Missouri.
For those who will not be, this is a question we've touched on tonight, but I just want to be perfectly clear because a lot of people watching likely have health insurance themselves already.
Mm-hmm.
Do they need to be worried about the marketplace? Will this have an impact on them?
It really has no impact on it. The marketplace has an impact on people who do have employer insurance they can't afford. If their employer has, they can go to the marketplace. If they're poor and not in Medicare and Medicaid, and they're above 100% of poverty, they can go to the marketplace. So there are people that, there are a lot of different folks that can go to the marketplace, and by going to the website, you can find out whether you're eligible or not. So you don't have to make a decision in advance, well, I'm not eligible, I'm not going to go to the website. Go to the website and find out.
Will it work? And
which part?
Will the marketplace? First, back to the top of the show. How important is the marketplace to the whole law?
The marketplace is absolutely critical. So we want to cover 50. There are 50 million people that need health insurance coverage. Of them, a certain amount would be covered by expanding Medicaid, which we're not doing in Missouri, of course. Others would be covered by their employers. Others would be covered in the marketplace. The idea here is to cover as many people as possible, and hopefully everybody eventually.
Okay, I've got to cut you off there because we're running out of airtime, but we hope you'll stick around for the post show. And again, don't forget 9net.org/health for Ed, Reggie, and everyone here. Thanks for watching and stay tuned.
9's health coverage is supported in part by the Missouri Foundation for Health.
Okay, thanks for sticking around on the post show here. Ed is back at the table along with everyone else. So Ed, let's, as I try to get up to speed here because I left my iPad on the wrong side of the room, help me get up to speed on what you've been seeing online.
Well, two things that came, throughout the night on Twitter that I think we could be some, we could address was one, that kudos to the Springfield library system. How more can libraries and other places like community centers can play a role?
That's not, as best I understand, that's nothing anyone asked them to do. I mean, this is not a provision in the law. Your library shall, and they've kind of taken that initiative.
So a compliment. That was really outstanding. And the other was actually on Facebook. Brett had mentioned, how do we get young people, this is a critical thing. We've been hearing it over and over. So how do we get them? What's the incentive? How do we do it to get them part of this? It seems like that's a big role.
Can we? What do you think?
Well, one thing survey literature tells us is they listen to their mothers. So I think we need to get their mothers talking to them about the importance of health insurance and taking care of their health.
Yes, ma'am.
Point.
Yeah.
And their sisters. We listen to our sisters too.
Your sisters too.
Yes. Okay. Let's keep that going. I'm curious. I mean, what are you hearing in your reporting? You're a young person. Are your fellow young people going to sign up for this? We're counting on you.
I think what a lot of young people are doing are staying on their parents' insurance until they're 26.
Yeah.
So, I mean, that is an important part of the Affordable Care Act. It's what I'm doing, that's for sure, until my parents decide to kick me off, which hopefully they won't. But yeah, that's, of my friends and people that I talk to my age, that seems like the popular thing to do, unless they have gotten some employer insurance.
I think it's very important because staying on, when you get to 26, it's going to be a big decision to drop off. It's not going to be like not getting on in the first place. You're on, and suddenly you're 26, you're dropping off, and you think, maybe this isn't a good, maybe I'm not invincible. Maybe this isn't
you're becoming accustomed to having insurance.
Yeah.
I think another point I'd like to make is that there's been a lot of effort put into social media in the campaign. I know the administration's been spending a lot of time on that and putting a lot into the ads into this. The other point I'd like to make, we know from the experience in Massachusetts, I just will make a prediction that we should not underestimate how much people really want insurance. You know, we've been hearing that there's been about 8 million hits or so on healthcare.gov. I will probably say that, you know, some of it is us. You know, I was on there 12 times the first day. But I think, you know,
you can only vote once.
Yeah, I think that these 50 million people that have been uninsured really want insurance. You know, and we've gone through the recession and such. So, you know, I think, you know, we saw that in that video from that woman. You know, I think people really don't like the risk of being without insurance. So I think, you know, young people are, you know, they were pretty fearful of being hit with those bills and medical debt. I know Sydney's done some research on that. So.
Well, and we know you've also done a show on young people and the young invincibles, and I think young people are starting to talk to each other. My law students have been going out in the community and doing talks to other young people. They've talked to over 2,500 people in the last year, telling them about the Affordable Care Act and these new opportunities. So I think this is social media. This is what they're going to see on the sitcoms, on The Daily Show. And getting the word out there.
Yeah, and a lot of the young people that you're talking about, if we start talking about 27 years old and older, some of them are parents, and they have children that really should look into the health insurance marketplace, because through the health insurance marketplace, families are also able to see if their children qualify for CHIP, which is a special part of Medicaid. They would want their kids to be covered. So,
Mark, you start to say something?
Yeah, I was going to say the other thing too is that as penalties increase over the next several years, that may also be a driver for bringing people back into wanting to purchase insurance, and that starts to increase their tax bill.
Yeah, I mean, young people, you cheat on your amount of tips that you make at the bar or whatever, you're not going to be worried about $92, I don't think, as a penalty. That's roughly what it is the first year. 95, okay.
Yeah, they don't see the money coming out of their check for their taxes anyway. They're not going to miss it when it's $695 either, versus the premium of a $217 for a 27-year-old for a bronze level plan. So that will be their choice.
What happened in Massachusetts when they instituted their penalty was right before the penalty went into effect. They had a lot of young, healthy men sign up for health insurance just right before that deadline.
If I might add, I know Massachusetts gets thrown out there as the success story, but we're not for the $26 billion that all of us paid to save that state, save the state, because the school districts and the municipalities were ready to declare bankruptcy.
I think I need to get my pen for next show, for another show topic that you just gave us here.
So
because I don't know
why is that always thrown out there?
I don't know. I think that's why we'll tackle it at another time.
It's an abject failure, though.
I'm not trying to blow you off. I'm just saying I think in the interest of trying to inform about the marketplaces as they are in Missouri, I don't think we can answer that in the limited time that we have here.
It's about 3 shows. Massachusetts alone is 3 shows in and of itself.
Yeah.
So.
I think Bill makes a good point that there are some parts about Massachusetts that don't apply here, but the point I will make is there's some aspects of behavioral economics we don't really understand. Well, I think we do understand, and I think Sydney makes a good point that you know, we may think that $100 penalty, you know, we wouldn't think people would respond well to this, but what we're learning from behavioral economics is people don't want to just throw away $100 for no reason.
More psychological
it's very psychological. They'd say, you know, if you think about it, why throw away $100 to get nothing when you can spend, you know, $1,000 or $500 and get insurance for it? Mm-hmm. That is actually a fairly rational, logical decision, and that's what we've been learning from behavioral economics and other literature.
They don't see it. It'd be one thing. It'd be one thing if they wrote a check. You know, it'd be one thing if we all wrote quarterly checks to the federal government for our taxes. We would have a revolt, but they don't write a check. It comes out of their tax return. They don't even see the money.
But wouldn't you want to get insurance for $500? Then get nothing for $100 or $500.
We will find out soon enough, I suppose. I want to go back to you because we just kind of on the air barely touched on the expansion of Gateway to Health. Can you? I think this is something that a lot of people don't know about.
Right. Yeah. Gateway to Better Health was intended to be a pilot project. It's a grant. Really is. so that people who are under 100% of poverty would have better access to health care, because Medicaid did not expand in the state of Missouri, and this is only applicable in St. Louis. So it was supposed to be a stopgap as well as a pilot project. One of the things that we have seen with Gateway to Better Health is that when we first rolled it out and people signed up for it at Grace Hill, immediately we saw people that had been holding their prescriptions, for example, that hadn't come to see the doctor for a while, starting to keep their appointments, started to, take care of their health. So over the past year or so that it has been in place, we have seen improvements in the health of our patients, simply because now they can afford their prescriptions, they can afford their primary care visits as well as their specialty care visits. So, as a pilot, I think that has already demonstrated that access to care does really impact the health status.
And does it impact the rest of us in some? We've talked about on this show before that that's not just taking care of one person's health, but it's an investment in a larger quality of the community.
This is the big unfinished business of the Affordable Care Act, in Missouri at least, because as Sydney mentioned earlier, there are going to be about 300,000 people that are a gap in a safety net, and it's wonderful what People's Clinic is doing, and the Gateway to Health is going to fill that gap for a short while, but believe me, we really need to do something about Medicaid expansion, because what we didn't do in Missouri last year is huge. We turned away about $1.5 billion this year, and that's gone. And we need to we can get $2 billion a year if we do it this year, and we can cover 300,000 people if we do that. And that's $2 billion, just like a helicopter drop into the state. And we know this economy is just stagnant right now, and we are losing jobs in this state. And if that $2 billion could be 24,000 jobs that's been reported from a University of Missouri study, and we are losing, now it's maybe several hundred jobs in this state because we're not doing this, and that's hurting healthcare providers and a trickle effect on others. So this is real people that are not getting insurance, and that's what's going to happen. So the legislature is going to deal with this issue. There's been interim committees working on this issue, and this is just a stopgap situation that Yvonne's dealing with it, and I think they're heroes for dealing with this, and I'm so glad that CMS continued that thing. I'm sorry to get very passionate about this, but
okay.
These are people under the poverty line.
And it's important people to come and enroll, because there are still available spots, and there are still so many people who live under 100% of poverty. At Grace Hill alone, we have 10,000 uninsured people who are under 100% of poverty. And reaching them, when you're talking about social media and things like that, people who are poor don't have access to social media, computers, things like that. So we have to go canvass, knock on doors, talk to churches, talk to, really one-on-one. And everybody who's listening tonight, everybody who's here at this table, please, tell people that they can come to Grace Hill any day, whenever we're open, and we will help them enroll into Gateway. We will also help them. We have certified application counselors with the health insurance marketplace, see if they qualify for the subsidies or whatever they might qualify for. So we're here to help the community, whoever they are.
Last word.
Okay, I wanted to say as a follow-up, if the greatest challenge is getting more people into the system, I think the follow-up challenge is getting people to care for them. Because if you're going to reduce Medicaid reimbursements and tell doctors you have to take care of more patients for less money, you need to find the incentives to get the doctors to still go into primary care. And I think there's a lot of great organizations out there who are doing what they can, but I think the bigger challenge is over the long term, getting enough primary care providers into the system to take care of. If we do get more people in, we need to take care of them. We need to give doctors incentives, doctors and nurse practitioners incentives to care for these people.
And remember that the Affordable Care Act raised reimbursement for primary care. It's increased loans and grants to get more doctors, more nurses, more mental health professionals, more public health workers.
Nurse-run clinics.
Nurse-run
But
clinics.
then lowered hospital reimbursements.
So do you know what's happening with the doctors right now?
Okay, let me hold it right there and say that we're going to continue this conversation, but we're going to run out of our stream here, and we'll leave people hanging because I want to say one last time, 9net missouri.org/health. You're already online. It's right there if you need more information. Right, Ed?
Absolutely.
Okay. All right. Thanks, guys. I appreciate it. Thanks, Ed. Thanks, everybody else.